David Hare is from NHS Partners, the group representing private healthcare providers.
I think what we are seeing at the moment, and the CQC are driving this, the NHS generally is driving this, is that transparency and openness is a fundamentally good thing. And getting some of that data out there and ensuring that it is used properly is, of course, critical. Now,
why isn't this stuff published? Your members could publish it, couldn't they? They could say, here we are being transparent, here's the number of serious injuries, and here's the number of deaths, unexpected deaths.
It's critical that people don't sort of jump to conclusions about increases in numbers. Each of those cases will have been reported to the Care Quality Commission. These are numbers that will be interrogated, and that's critical. And we've seen in the NHS, for example, the number of serious incidents rise from virtually zero 15 years ago to 500,000 a quarter now. That doesn't indicate that the NHS is much less safe. What it demonstrates is we're getting data out there.
In terms of those figures, they're quite staggering figures, aren't they? 191% rise in serious injuries, for example. At the very least, isn't that an indication of how poor your reporting of figures was before the pressure came on?
I will be the first to accept that this sector has been on a journey in terms of reporting information and ensuring there is absolute transparency about what is out there. There is a little bit further to go, but the journey this sector has embarked on is a positive one, and the performance of the sector compares very favourably across healthcare in England.